My name is Todd Abercrombie. It's my privilege to be the Executive Director of the MS Society of Canada, South Vancouver Island chapter here in Victoria. We're also in Duncan as well. So tonight I'm going to do a couple of things before I throw it over to Ernie Stigant, our MC. I want to thank the organizing committee that helped make this event possible tonight. Sandra Burrell, Braden Corby, Carol Powell, Ernie Stigant, Bonnie Pashik, and Katie Gannison. So they did a ton of work to pull this evening together. We want to have a great round of applause for them. Thank you so much. We'd like to thank the Comfort Hotel as well and Conference Center for their hosting of us this evening. They've done a super job for us. We also like to thank our sponsors for making this evening possible. The Millenium Stars, the MS Society of Canada South Vancouver Island chapter, and the National CCSVI Society. So we have great support. We're going to have a wonderful evening together and lots of great information shared. I'm going to just briefly give an outline of MS Society Canada's position on CCSVI and then just speak a little candidly about it and then throw it over to Ernie. So CCSVI has opened new avenues of research, and the MS Society of Canada has been very proactive in accelerating the quest for answers. Some would disagree with that. Our focus is people living with MS. They're the center of our work and will continue to be what drives us as we move through the exciting and new phase of MS research into CCSVI. The MS Society honors and respects the decisions Canadians living with MS make for the benefit of their own health. We acknowledge and respect that some Canadians living with MS have traveled abroad to seek CCSVI-related procedures, and others have decided to wait for more research to be done. We encourage all Canadians interested that are living with MS to visit our new website at ccsvi.ca, which was just recently launched in March, which has comprehensive information about all matters related to CCSVI. And I think you'll find it's a much more balanced approach to CCSVI. It's not quite as cautious as I think we probably have been in the past. So hopefully you'll be pleasantly surprised by it and challenge us to continue to make that website a very effective tool. Just candidly about CCSVI, it's clearly been a very challenging area, an area that has created a lot of emotion, and you know, we've upset a lot of people, there's no doubt about that. There's been a lot of frustration. That is something that happens when you have something that's so new and potentially fantastic as CCSVI is. What we know from our discussions with federal and provincial governments is that they want a complete clinical trial before they're going to bring CCSVI into the Canadian healthcare system. Part of our mandate is to establish research in MS, and that is what we're doing to move that research forward. In the meantime, it leaves many of our clients and members in a position of having to fund their own, their private healthcare to receive CCSVI, and not even, to make matters worse, it's not even available in Canada. So it's very challenging. It's not a position we'd want anyone to be in, but yet that is what we all face right now. Many people are doing their own fundraising to get the treatment, and many people have gone and received treatment. And we're going to hear from the group tonight in our panel about their experiences. The availability of CCSVI in Canada, of course, cannot come soon enough. The MS Society has set aside $1 million to make to start the clinical trials as soon as they're ready to go. So we are trying to be as proactive as we can to get things rolling as soon as we can. And what I can say is, in the long and the short run, that the MS Society is going to continue to work hard to raise funds for MS research into CCSVI and other quality MS research, and continue to provide much needed programs and services for people living with MS. So that is our dual mission, and we've been doing that for over 60 years. We're going to keep working really hard at that. So that's what I wanted to lead off with tonight. I'm happy to move it over to Ernie Stigant so we can continue this great evening and get the panel started. So Ernie, over to you.